synthesizes, plans. What teenager do we know that plans, right? Plans and then implements that plan. This part of the brain, going back to the Latin again, is responsive. Okay, Latin test again. Shall we try? RES, what does res mean? A thing, right. And pondere?
Think.
Right, exactly right. When someone is responsive, they are thinking about a thing. Okay, so they need to be in this part of the brain, prefrontal cortex, all those goodies that this part of the brain has, right, which doesn't fully develop until age 30. Please remember that, okay? That's what we're looking for, a responsive part of the brain. Now, just to make things a little more complicated, but it is useful to know, the amygdala. Anybody ever hear of the amygdala? The amygdala is the control center for emotions. The amygdala is what takes information from the limbic area, because everything goes into the limbic area first, shoots through this, I like to think of it as like a little pet door, okay, that kind of swings either way. Information comes through here and it eventually goes over here to be acted on by the CEO, okay? However, funny things can happen to the amygdala. If the amygdala is working well, this happens. The more the brain develops, the more this happens, all right? However, there are certain situations where the amygdala will actually change shape. Children, we've seen on PET scans, we see that children have been sexually abused. This amygdala will actually change shape, all right? Post-traumatic stress syndrome. A lot of our GIs coming back from Iraq right now. The amygdala has changed shape, all right? A great deal of stress coming in. The amygdala can't work fast enough. And so what happens in all of those situations, people get stuck in limbic. Flee, fight, or freeze. Okay? Now let's go back to therapy. All right. When you have an individual who has perhaps gone through some of those conditions, abuse, all right, trauma, and there are some neurological conditions which will also make the amygdala sluggish or stuck, let's put it that way, all right? We're dealing with someone who is used to thinking in reactive mode, all right, and will talk to you. Well, I did that because of what was done to me, okay? To get them unstuck from that, all right, they have to have something before they actually get into the business of changing their behavior. They need to be taught some things, all right? I used to like to say to my staff that before you come up with a diagnosis, before you define pathology, consider ignorance, all right? People either have not been in a situation where they've been taught some things, how to handle things appropriately, or things have happened, all right, which keeps them here and doesn't allow them to get to this part, to the sensible part of their brain, to the in control part of their brain, to the part of their brain that makes choices. Okay? Sound like a crazy idea? It's actually not rocket science, all right? It's really pretty straightforward. You see somebody out of control, you're not going to do therapy with them. You're going to stabilize them, you're going to get them settled down, and you're going to start to educate them. Okay, now, who knows what the worst possible word in English is? I don't mean a scatological one. I mean one that affects you. If you think of some of the things that have been said to you in your life that bring a strong reaction, don't they usually have that horrible SH word in it? Should. You shouldn't do that. You should do this, all right? What happens when you hear that word should? For a lot of people, if we put a cuff on them, we're going to see their blood pressure goes up. All right? They're either in the mode of being judged or judging. They are in limbic mode. All right? They're going to either run away from the judgment, they're going to fight to prove that they're right, or they're going to be overwhelmed and freeze because they're in the state of being judged. Horrible word. All right? It induces shame. It causes no forward movement. It's what shall we say? It is reactive. It keeps people stuck, and it is judgment-based. All right? Certainly no way to encourage a person to make some changes in their lives. All right? We have to teach people to drop shoulds and get into a lovely word. It only requires dropping two consonants and putting another one in. Could. All right? For every should, drop the SH, drop the shame, all right, and substitute a C. Use your creativity. Use your capabilities. Use your competence. What could I do in this situation? Okay? So when we're talking about moving people into therapy, there's this whole process of looking at their thinking, all right, and seeing if they can get away from the kind of things that get them out of here and into this. Okay? Because what we need them to do is we need to take a look at their past behavior. We need them to catch themselves and allow themselves to feel uncomfortable knowing that they don't quite know what to do yet. But if this sends them back here, we've lost them again. Okay? We need them to basically come up with some other ideas. We can help them with some other ideas. We can educate them with some other ideas. And then we need them to go ahead and act differently. All right? 13% of the people that we encounter in a community mental health center can get here. Can you understand why now? Okay? Because we're basically working with brains that have been affected here. Okay? Any question on that? Interesting, isn't it? It's not the way we usually look at therapy. You know, you go lay and talk to your therapist and tell him what, you know, what your horrible mother did to you, or how your father didn't come home, and? Okay, please.
So you're saying that if a child has been sexually abused, the PET scan can show that
Amygdala.
has been affected?
Yes.
Okay. Can it get back to normal?
The brain is amazingly elastic, all right? Plastic and elastic. It's not going to happen overnight. All right, this is why we're talking about the educative part of treatment, all right? People can be taught how to do things, all right? First of all, to settle this area down so it doesn't feel like it's in crisis state, and then work it through to this. All right, so even someone who has been abused, you know, someone who has, you know, for example, let me give you a good example on this. You know what the best treatment for our Iraqi post-traumatic stress veterans is?
No.
Okay, exposure. Exposure
To what?
to their trauma. Okay? To have them look at it either mentally or even visually over and over and over again so that it loses its sting. Now, do we want to do this with kids who've been abused? No. Okay? But it works with those veterans. All right? Because what happens then is by being exposed over and over and over again to it, it is no longer new information. And it's so counterintuitive. You would say, you know, let's get them away, let's relax them. It doesn't work. Because what happens there is you encourage a phobia, all right? You keep them out of a group of people. You keep them out of whatever it is, all right? Well, phobias are very useful to keep the phobia going, because you're basically rewarding by relief, all right, not being in that situation again. So phobias are self-perpetuating. On the other hand, if you're afraid of rabbits, well, you can go through life without ever seeing a rabbit, touching a rabbit. You're fine. But what if you were a rabbit farmer, all right? You're going to become extremely dysfunctional in your work unless you finally approach those rabbits and deal with those rabbits. Going back to the abused children, right? What we have to do is really help them to get to this part of the brain. Now, problem is, kids don't have this fully developed yet, all right? But interestingly enough, by teaching them, all right, early alert, all right, you are feeling uncomfortable with an individual, all right? What do you do with that feeling? And you teach them appropriate things to do with that feeling. You teach them appropriate ways of behaving. You teach them what the safety mechanisms are, all right? The operative word here is you teach those kids, all right, what's out there, what's available for them. So what you're actually doing is you're pushing this part of the brain, all right, to kind of pass over that distorted amygdala. It's sort of, if anybody's ever been in fitness training, all right, when you want to develop a muscle, what do? You keep working it and working it and working it. So when we have these children, what we do is we keep saying, okay, how did you feel? Okay, who was there? Where could you be? Who else was there? What could you say? You're teaching them mastery skills. And that basically gets here. Okay, does that answer your question?
Yeah, no, it's a long haul process.
It's a long haul process. Much longer. The Iraqi veterans are much easier to deal with. Much easier to deal with.
Thank you.
Okay. Okay, you had a question? I'm sorry?
Because they're adults?
Because they have more of that, we hope. Depends on their age. You know, we have some really young kids out there too.
Does that also apply to adults who have been sexually abused but never particularly addressed that issue in their life?
That's a trickier one. That's really a trickier one because there are certain things as false memories. I mean, we could get into a whole discussion about that, all right? I have had, patients. I had a family, 5 women, all right, they were age 40 to maybe the youngest was mid-20s or so. Every single one of them was sexually abused by an alcoholic stepfather, okay? There was never any time in their life that these 5 women did not recall the abuse, okay? And what was really let's say, an immense opportunity for them is when one of them broke down one evening, this is when they were little girls, all right, and told the other ones what had happened, and they all talked about it, okay? I saw those women later on, not because of their own issues, all right, but as a group. It was a very interesting situation because the stepfather had come back into their lives and they were concerned about their own children, okay? And they were in how to prepare their children, for grandfather, okay? So, a lot of the stuff about repressed memories, I think if you go through the research, it doesn't hold up. It really doesn't hold up, okay? Now, I have to say something. I'm a clinical psychologist, all right? Our training is very, very much based on research. We have this kind of code that there's a thing called, efficacy-based treatment. Has anybody ever heard about that? Okay. Efficacy-based treatment is treatment that has been proven through research. Okay? If we don't do this, I don't think any other of the mental health professions has this, maybe medicine does with their standards of care. But if there is a disorder and we know there is an efficacy-based treatment that is prescribed for that disorder, and we don't provide it, all right, we can be deemed negligible in treatment. So for example, if you're dealing with a borderline, all right, patient, I'm sure folks here have probably encountered borderlines, right? Oh yes, got to peel them off of you, don't you, right? The treatment of choice for borderlines is dialectic behavioral therapy, period. That's it. You want to treat a borderline, you must use dialectic behavioral therapy. Okay, if you're not getting that, you're not treating the borderline. Just like if you're not treating the post-traumatic stress Iraqi veteran, all right, with exposure treatment, you're not treating them. Okay, now, other professions will probably argue with me. I will go to the research and I will show them, but that's, again, that's for another day, another time, okay? So, so can you see why treatment, therapy, change, behavioral change is usually the least likely to happen in therapy, in treatment? Yes, please.
Do you, also, if somebody's in that limbic stage, do you ever find in your experience that they can fight by reacting how they know you expect them to act? In other words, somebody comes between you and your therapist, and they know that they're either going to have to go into therapy or treatment, but they also, in their limbic brain, their way of fighting is behaving properly. So you'll look at them and say, "Richard, there's no problem here."
No, because they would have to analyze the situation. They would have to plan. All right. Now, what you're talking about, somebody who's verging on sociopathic. Okay. There's nothing to say that a sociopath isn't over here. Okay. We're talking about people who are hurting, personally hurting. All right. Who are desperate, who are scared. All right. This is when we get this kind of behavior, all right? When we get over here, we can have people who have learned maladaptive patterns of doing this, all right? It's just probably kind of might sound funny, but you know one of my main jobs is to make people neurotic? I kid you not, all right? Now what is a neurotic? Anybody want to take a guess at what a neurotic is? A neurotic is an individual who is very uncomfortable with themselves, all right? They're very self-critical. They obsess about, oh, I should have done this and that, you know, that kind of thing. They are navel-gazing all the time, all right? But the nice thing about neurotics is that they're willing to look at themselves, all right? On the other hand, someone who has a personality disorder, it's simply the way things are done. They don't think about it. This is where we get, well, I did this because this was done to me. We're talking about personality disorders there. And so my job as a therapist, as a change agent, is to make them neurotic. All right, is to hold up the mirror and to show them, all right, that what they're doing really doesn't have good or lasting effects, and that there's other alternatives, okay? But people can go over here and get stuck in some really nasty habits because they figured it out, all right? And they rationalize it and they do all sorts of things, all right? So that's why I often say, I don't care how you got here. What you're doing isn't working. You know, your mother's dead, your father's dead, you know, the guy who abused you is dead, all right? So what are we going to do now? Please.
How are you determining, I mean, you don't run a PET scan or any of these other exotic scans for the most part on people, so is it more of a trial and error to see exactly what stage that they're in when you're trying to make your analysis of how to fit them?
You know, there's some fairly easy questions that you can ask people. One of them is, how do you think you colluded with that? All right? Do you think there would be something else you could do that might make this different? All right, in other words, you go back to the individual and you're basically ask them how much ownership they're willing to take for looking at this differently. All right? If an individual keeps coming, but this happened to me and this happened to me, okay, then back off, all right? We'll work up to it. We'll see if we can get there. Now, very honestly, if a person is in crisis, we can't do therapy. We can't do change because they're going to be here. They're going to be living here. All right? You can't do anything when they're living there.
When you're dealing with adults, or semi-adults, however you define adults in this case, I can see that being more effective, when you're dealing with children. It seems to me it becomes much harder to figure this out and to help us dealing with
Yes.
children who may have gone through
Yes.
trauma
Yes.
or stuff like that.
Yes.
And we have these reports, but
Okay.
what do you do with it?
You have to look at behavior. All right? We can't see people's thoughts. We can have them verbalize thoughts, all right? But particularly with children, have you folks heard about the different languages that children speak? And I don't mean foreign languages. Okay. When you dream, okay, you see pictures or you have images, and sometimes there's a story to them and sometimes there isn't, all right? That's how children think, all right? They think in something we call primary process. Frankly, because the rest of their brain isn't developed yet to have constancy, to keep things in their mind, to say, this lady wore a blue shirt on that particular day, but I see her face, and if she comes in next week with a red shirt, it's still the same person. Kids don't think like that, all right? If you notice what they do in child therapy, right, in the early ages, they use something we call play therapy, all right, which might be using dolls or using little puppets or things of that sort. Not so much to have the child tell the story, but to see what the child does with that. All right, can the child, put a family group together and they're having dinner, or they're going to be outside playing ball or something like that, or do you see a chaos, dolls fighting dolls and things of that sort, all right? You get a state of an agitation, all right, that any calming or any thinking doesn't settle down. You have to wonder what's going on here, that this child can move out of that. In a calm situation, there's nothing threatening them at that particular time. There's no outside stimulus, and yet they stay with these things. Okay, does that make sense to you? So observation, what I used to like to do is give parents tasks to do with the child, be in a one-way mirror situation. I would be on the other side of the mirror with the tasks that the parents and the child would have to do, and just watch them. Just watch what goes on there. Watch what's happening with the child, watch what the parent does to get the child to do the tasks. Amazing information. You don't need a PET scan in those situations. You can see it. You can see it. Okay, does that answer your question there? Okay. As CASA volunteers, you're going to be making observations. You're going to be helping with the referral process.